Melanie, can you tell me a little bit about your background before you became a naturopathic practitioner?
Yeah, I actually have a degree in civil engineering, and I was working for a software company, traveling all the time, probably not taking good care of myself. I developed a bunch of chronic health issues. So I went to a naturopathic doctor, and he helped me bring my body into balance and get healthy. And then I started, some of my patients started having allergy symptoms. I had a patient with anaphylaxis to peanut actually. So I started looking into NAET or options for that, because there's not really a lot of good options for kids for that. And so that's how I found out about it, and then went to California to get certified as a practitioner for NAET. I also went back to school for my doctorate in naturopathic medicine.
Oh, it sounds like you have a lot of experience.
Yeah, well, I finished my doctorate in 2011, so I've been in practice since then.
That's a long time.
Yeah,
yeah, it does. I was wondering about NAETs because I've done a few of them. I'm a patient here, and there's a lot that I have questions about. Can you explain to me how the energy works from a scientific standpoint?
Yeah, absolutely. Well, a lot of people don't realize, but our body is very electrical. Our nervous system, if people have had any kind of studies like nerve conduction studies, that's what it's measuring is electrical impulses. So from an energy standpoint in Chinese medicine, every problem comes down to imbalance or blockage in the meridians or the energy channels. And so NAET is removing that blockage so the body no longer responds.
How does, I've seen the vials where you have the energy of certain things, like for example, gallbladder or like dairy.
Yeah.
How do they get the energy? Like, how does that vial become the energy?
Yeah, so it gets imprinted. There's an output setting of that frequency. So again, everything has a frequency or an energy. Even our table, it looks solid, but it's really not solid, right? It's got an energy to it. So electrons and protons, I'll remember that from science class. And so they imprint the vials with the frequency of whatever. It could be dairy, it can be grass, weeds, and so that frequency of that item gets imprinted to that vial.
Is it a special machine that does that?
Yeah, it comes from the NAET headquarters in California, so they do have a special machine that will imprint them. I've seen it, it's pretty cool.
How did the main doctor, I think you told me the story before, but I can't remember it. How did the doctor who invented NAET come up with it?
So Dr. Nambudripad, who's the N in NAET, she had all kinds of allergies and sensitivities to things. At the time she created it, she only could eat carrots and rice.
Oh.
And she, was studying natural medicine, and she was still having these reactions. And one day she went to have acupuncture and realized she had a carrot in her pocket and had the treatment. And after she was like, well, I'm gonna see if I can eat the carrot. And she ate it, she had less of a reaction. So then she started studying more Chinese medicine. She's an MD, chiropractor, and acupuncturist. And so that time she's like, I'm gonna start studying. And she created the protocol, she came up with it. So a very smart lady.
That's really cool.
Yeah.
One thing I've seen you do that is really cool is when you ask the body about what's actually causing the electrical disruption that needs the NAET. And somehow, even if you do the question without speaking, you know the answer. How does that work?
I use muscle testing to ask questions to the body. So thought is energy, so we can ask the body, what is causing the disruption? Is it, environmental? Is it foods? Is it emotions? And, may get information that way by muscle testing. Sometimes it's just intuition that something will come to me, and I'll muscle test and that'll be it. So it's kind of a combination of things of asking the body, but then also using my intuition.
Okay.
One thing I always tell people when I try to explain about NAETs is that, it doesn't make sense, but somehow it works. And I know that you've mentioned about the electrical energy and the intuition and stuff, how many practitioners can use the intuition? Because I forget if I've told you, but I actually went to another NAET person back when I lived in Illinois, and they did it completely differently, and it feels like you have more of a gift for it. Can you explain that a little bit?
Yeah, that's a good question. I don't know that I can answer how many practitioners with the intuition piece. I think the longer that you, as a practitioner, deal with people, you just develop that intuition. I never thought that I had intuition until I started practicing NAET on patients, and then these feelings would come to me. So I think it depends on the person, for sure. For me, it's just kind of a feeling and a knowing when I'm with the person, which is why I definitely prefer seeing people in person versus virtual. I mean, we can't do NAET virtually anyway, but it's just something about being with that person and developing that feeling.
Mm-hmm. Yes. Can you tell me a little bit more about what the images are like? Because I know that, and I'll share more about this, I'm happy to give a testimonial, but I know one of the things that happened one time was you actually pictured corn while doing muscle testing on my son, and then there was a cornfield we didn't even notice. So can you tell me a little bit more about how that works? Because it's very fascinating.
Yeah, great question. For me, I would think it's similar to a message that I get. I don't know if I necessarily, sometimes I might say I see corn, but I think it's more of just a message that I might get when I'm muscle testing the person or when I'm with the patient. So, and then when I get that message, I also get kind of cold chills, almost like goosebumps, and that's when I know I'm on the right track.
So it's kind of the body telling you what's bothering it, through energy.
Yeah, absolutely. It's a energetic connection between me and the patient.
So I know you've told me that it's kind of hard for you to explain because you don't really think anything of it. Do you have an explanation for it, maybe from your engineering background, about how the energy might work with your scientific mind?
Yeah, I guess from that standpoint, it would be just the fact that everything is energy. Wi-Fi, that signal is shared throughout. It's kind of that same idea where it's a signal or impulse, and this energy that's shared between me and the patient.
I hadn't thought about the Wi-Fi, because in some ways our smartphones do seem kind of like magic in a way, the way they work.
Yeah. Sure.
Do you know if NAET is because it mentioned that it was along the meridians, which is practiced in Chinese medicine. Is NAET a pretty common thing in other countries? I know here we're more into Western medicine, but what about other countries?
It is practiced worldwide. NAET is. There's about 10,000 practitioners worldwide.
Wow.
Yeah, I think it's unfortunate that more people don't know about it. And I don't know. I think it's kind of a word of mouth thing because it is hard to explain to people. I usually tell people, explain it. It's acupressure treatment for allergies. It's a simple way to treat it because it is acupressure that I'm using, and it's Chinese medicine, so most people get that idea. But yeah, so was that your question?
Yeah.
Okay.
How does it work because this was something that really fascinated me, because I know if when I bring my son, he's not gonna hold still or let you do the acupressure. And so I know you've had me kind of gently hold, onto his foot,
Yeah.
and then you do the testing on me, and then you do the treatment on me, and then somehow that treatment, and I've seen it work on him, even though you're doing it to me, he's the one who feels better. How does that work?
Yeah, so using a surrogate, which I do that with small children, also if somebody has a severe allergy to something, once we get to that treatment, I don't like them to touch that vial, so I'll use a surrogate for that as well. So it's just the energy, that chain of energy, the last person in the chain is getting treated.
I remember reading, like it was in science class in college, I don't know, but like if someone's, like if there's a bunch of people standing in water and somebody gets shocked, like the last person is the one who feels it. And so I was just wondering, is that how the energy kind of transfers in a similar way?
Yeah, that's exactly right. You're acting like a conduit when you're a surrogate.
Okay, because I know I've seen it work. Like when my son had to be on thickener for a long time, he's just now starting to get off of it. And the first time we gave him the thickener, he would like cry and grab his belly. And we're like, well, what are we gonna do? He has to have the thickener. There was no other thickener that was as healthy as this one was. So I had brought him in, and even though you were doing the NAET on me and I was touching his foot, then the next day, after 24 hours, he was able to, and he's had that thickener for like, it's been 4 years now, and he hasn't complained of like any stomach issues, and he stopped grabbing his stomach. Yeah. So I've seen it work. It's just one of those things where like, what would you tell people who are kind of having trouble, I don't know if belief is the right word, but just being willing to like give something super weird that makes no sense to try for their health?
Yeah, good question. The way I explain it to patients from a physiological point of view, what NAET is doing is it's stopping the nervous system from responding to the allergen. So in allergies, the very first thing that triggers your nervous system, and then the nervous system triggers the immune system. So in NAET, what we're doing by stimulating the nerve roots along the spine is we're stopping the nervous system response at all. And you can look at that through, this physiological body and the body, the nervous system being electrical, or from Chinese medicine standpoint, like however it helps your brain, get that. But yeah, it's just, that's all that's happening. So it is a physiological response that's happening in the body. It's not, just like magic.
Yeah, it does. It does feel
it is
like
magic. But
it
yeah.
does feel like magic, but
right.
I know that like for people with allergies, a lot of the times the only options they have are like avoidance or shots. And I know for me, when I was sick, like everything like just showed up fine. And even though I was having these horrible reactions, it wasn't a full, I forget, like it was an IgG or IG, whichever one, like it didn't have the actual allergy response. It was an intolerance.
Mm-hmm.
And so there's not a whole lot that, because I went to so many doctors and there just wasn't a whole lot they could do because it was an intolerance.
Yeah.
So that's what kind of got me to the point where I was like, okay, I tried this in Illinois, like it sort of worked. The practitioner unfortunately wasn't as efficient. And I'm like, okay, I'm gonna give it another try.
Oh, good.
So is it usually people who like have just kind of reached the point where like they've tried everything else that usually come to see you, or what kinds of people usually come to see you?
Well, I think it's probably a mix. I do see people that maybe have tried allergy shots and they didn't work, but I also see people that just want another way of dealing with it. I think for the allergy shots, the downside is sometimes they have to stay on them for years, whereas in NAET, you don't have to keep doing, over and over. So it is more dealing with more a root cause problem. So I do see kind of a mix there. I see people with immediate allergies as well as sensitivities, like you kind of differentiate between that. So when somebody has like an immediate severe allergy, of course, I don't treat it and say, go eat it the next day. There's a process that we have. And NAET will also work for anaphylaxis, but again, there is a protocol to that that we follow pretty strictly.
Okay, cool.
Yeah.
Is there anything else that you think people should know when deciding about whether or not they want to try something that's very just unique?
Yeah. Well, I think sometimes I'm even surprised at what happens with people. They could come in for whatever, like a dairy sensitivity or egg or, and all of a sudden they're like, I'm sleeping better, my mood is better, or the pain in my foot went away. So I think sometimes we think like allergies are just, itchy eyes, runny nose, or if you have a sensitivity to dairy, it might be stomach issues. But it actually is affecting your body in other ways too. Could be just due to inflammation or high histamines, So I think that it's quite surprising how different people feel just by doing the protocol and lowering those histamines.